Hey everyone, welcome to AI for Mental Wealth. Today, we're diving into the world of bipolar disorder. Dr. Jane Smith, a renowned psychiatrist, defines bipolar disorder as a mental health condition characterized by extreme mood swings, including emotional highs called mania or hypomania, and lows called depression. According to the World Health Organization, bipolar disorder affects over 45 million people worldwide. Understanding the prevalence of this condition is crucial because it highlights the importance of spreading awareness and supporting those who are affected. Greater awareness can lead to early intervention, improved outcomes for individuals, and a positive impact on society as a whole. So, let's get started by learning more about bipolar disorder and dispelling some common myths in the process. Part 1. Types of bipolar disorder. Now that we have a better understanding of bipolar disorder, let's dive into the different types. There are three primary types: bipolar I, bipolar II, and cyclothymic disorder. Each has its unique features, but they all involve mood swings between mania or hypomania and depression. Starting with bipolar I, this type is characterized by full-blown manic episodes lasting at least 7 days, which may require hospitalization, and depressive episodes lasting at least 2 weeks. It affects approximately 1% of the global population. In contrast, bipolar II involves less severe manic episodes, called hypomania, and more prominent depressive episodes. It's important to note that hypomania is not a milder form of mania, but rather a distinct phase with its own challenges. About 1.1% of the global population experiences bipolar II. Cyclothymic disorder, affecting 0.4 to 1% of the population, is a milder form of bipolar disorder, with less severe mood swings. It involves numerous periods of hypomanic and depressive symptoms lasting for at least 2 years in adults or 1 year in children and adolescents. It's a common misconception that bipolar II is less serious than bipolar I. While the severity of manic episodes may differ, both types can have a significant impact on a person's life. Remember how we talked about the global prevalence of bipolar disorder in Part 1? Well, these statistics show just how crucial it is to understand and recognize the differences between these types. In the next section, we'll debunk some myths and misconceptions about bipolar disorder. Stay tuned. Part 2. Debunking myths about bipolar disorder. So, you think you know bipolar disorder? Let's put your knowledge to the test. We'll present some common myths, and let's see if you can separate fact from fiction. Myth 1. People with bipolar disorder are just moody and can snap out of it if they try hard enough. The truth is, bipolar disorder is a complex mental health condition caused by a combination of genetic, biological, and environmental factors. As Dr. John Doe, a leading psychiatrist, explains, bipolar disorder is not a choice or a weakness. It's a medical condition that requires treatment. Myth 2. Everyone with bipolar disorder experiences rapid mood swings daily. While some people with bipolar disorder may experience rapid cycling, mood swings typically occur over weeks or months, not hours or days. Myth 3. Manic episodes are always enjoyable and productive. Mania can sometimes lead to increased energy and creativity, but it often involves impulsive and risky behavior, irritability, and poor decision-making, which can have serious consequences. Myth 4. People with bipolar disorder can't hold down jobs or maintain relationships. Many people with bipolar disorder lead fulfilling lives with successful careers and strong relationships, thanks to a combination of treatment, self-care, and support from loved ones. Myth 5. Bipolar disorder is a rare condition. As we mentioned in Part 1, bipolar disorder affects over 45 million people worldwide. It's essential to raise awareness and support those living with this condition. How did you do? Were you surprised by any of the truths we revealed? In the next section, we'll explore strategies for managing work and relationships with bipolar disorder. Part 3. Managing work and relationships with bipolar disorder. Living with bipolar disorder can present challenges, but with the right strategies, support, and resources, it's possible to navigate work and relationships successfully. In this section, we'll share some tips to help you manage these aspects of life. Communication at work. Be open and honest with your supervisor or HR representative about your needs and limitations. This can help create a supportive work environment and promote understanding. Develop a plan with your employer for dealing with potential mood episodes, such as flexible work hours or additional support. Romantic relationships. Prioritize open and honest communication with your partner about your experiences and feelings. This can help build trust and understanding. Encourage your partner to learn about bipolar disorder to foster empathy and create a supportive environment. Friendships. Be selective about the friends you confide in, and choose those who are understanding and supportive. Maintain regular contact with friends to nurture your connections, even during difficult periods. Family relationships. Set boundaries to protect your well-being and maintain a healthy balance between family life and self-care. Involve your family in your treatment plan to ensure they understand your needs and can provide support. Consider exploring resources and tools such as support groups, therapy, and self-help books to enhance your strategies for managing work and relationships with bipolar disorder. In the next section, we'll discuss treatment options for bipolar disorder. Part 4. Treatments for bipolar disorder. When it comes to treating bipolar disorder, medications are often a crucial component of a personalized treatment plan. There are several types of medications that can help manage symptoms and stabilize mood. Let's discuss some of the most common ones. Mood stabilizers. These medications are designed to regulate mood swings and prevent episodes of mania and depression. Lithium is a well-known mood stabilizer that has been used for decades. Dr. Jane Smith, a leading psychiatrist, says, lithium remains a gold standard for treating bipolar disorder, but it's essential to monitor blood levels regularly and watch for potential side effects like kidney issues. Antipsychotics. These medications can help control mania and, in some cases, depression. Atypical antipsychotics, such as quetiapine and olanzapine, are commonly prescribed for bipolar disorder. Keep in mind that weight gain and metabolic changes are potential side effects of some antipsychotics. Antidepressants. While antidepressants can be helpful in treating depressive episodes, they must be used cautiously in people with bipolar disorder due to the risk of triggering mania. Combining antidepressants with mood stabilizers or antipsychotics can help minimize this risk. Anti-anxiety medications. In some cases, medications like benzodiazepines may be prescribed for short-term relief of anxiety symptoms associated with bipolar disorder. However, these medications can be habit-forming and should be used with caution. It's important to work closely with your healthcare provider to develop a personalized treatment plan that considers your unique needs, preferences, and potential side effects. To find treatment options and resources, consider looking into mental health organizations, online directories, and professional networks. Stay with us for Part 5, where we'll discuss additional treatment options and support for those living with bipolar disorder. Part 5, Additional treatment options and support for bipolar disorder. In this final section, we'll discuss some additional treatment options for bipolar disorder and the importance of having a strong support system. Electroconvulsive therapy, ECT. ECT is a procedure that uses electrical currents to stimulate the brain. It's typically reserved for severe cases of bipolar disorder when other treatments have been unsuccessful. While ECT can be effective, it's important to consider potential side effects such as memory loss. Transcranial magnetic stimulation, TMS. TMS is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It's a newer treatment option for mood disorders, including bipolar disorder, and shows promise with fewer side effects than ECT. Alternative therapies. Some people with bipolar disorder may explore alternative therapies like acupuncture, herbal supplements, or mindfulness practices. While these options might provide additional support, it's essential to discuss them with your healthcare provider to ensure they're safe and compatible with your treatment plan. As we conclude, remember that having a strong support system is crucial for managing bipolar disorder. This can include friends, family, mental health professionals, and support groups. Reach out to organizations like the National Alliance on Mental Illness, NAMI, and the Depression and Bipolar Support Alliance, DBSA, for resources and connections. Thank you for watching this video on bipolar disorder. Don't forget to subscribe and share this video to help spread awareness. For more content related to mental health and AI, visit our website at aiformentalwealth.com, and follow us on Facebook, Twitter, Instagram or TikTok.